right? This is Jessie Tebow, Skills 1 Online, and this is going to be my Unit 4 validation. As you can see, this is my living room. I have no cheat notes. This is my table. Everything's far away from where I'll be sitting, which is right there next to my husband, who is going to be my test subject today. I will start with rooming the patient, and then I will continue on with the ear irrigation. Oh, and here's my tablet that I'll be using to record, which has no cheat notes in there. And my pen. All right, so knock knock. And I'm performing my proper hand hygiene so my hands are nice and clean. Hi, my name is Jessie. I'm going to be your nurse this afternoon. Could you please inform me of your last four of your social, please?
8277.
Okay, and your last name?
Tebow.
And your date of birth?
6885.
All right, so Mr. Tebow, what brings you in today?
I'm having a hard time hearing my ear.
Your ears are a little clogged up?
Yeah.
Okay. All right, well, let's just get a quick height and weight. My BMI chart's over there. Okay, if you could stand up for me, please. I'm going to take his height in inches. So standing up there and there. Or else I would also have a weight scale that has a height scale on there. But Kevin is 75 inches. And if you could please step onto the scale for me while I go grab my BMI chart. So Kevin, you are 75 inches and 205 pounds. And 75 inches, that puts your BMI at a 25. So you're just slightly overweight, but I think, you know, it might be mostly muscle because you're such a strapping young man. Okay. All right, and if you just want to have a seat, we'll take your vital signs. And right now what I would do is I would take his blood pressure, his temperature, his respiration, his pulse, and his oxygen levels. And I would do it manually with the blood pressure cuff and use a pulse oximeter for his O2 sats. And everything's normal. Kevin's a healthy young man. Do you have any allergies to medications?
No.
Do you have any other allergies?
No.
Okay, so no allergies. Are you currently on any medicine?
No.
Okay, and do you use tobacco?
No.
Are you around any secondhand smoke?
No.
All right. And you're aware of the problems, ignore the cat please, the problems that smoking can cause with lung cancer and
Yes.
all those. Okay, great. And well then, let me get set up and we'll see what we can do for your ear.
Okay.
Okay. Let me just take my otoscope and take a peek in your ear canal here. Just if you want to tilt your head down a little bit so I can see in there. Tilting his ear back and up so I can get a good look into his ear canal. And there is some clogging there. Some cerumen. So I've checked with the doctor's orders and he's stated to do an ear irrigation. So I'm going to drape my patient to provide comfort so that he doesn't get all wet. And then Kevin, this procedure may cause a little bit of discomfort and some dizziness since the solution will be flowing against the tympanic membrane some. So I'm checking my doctor's solution. The solution has not expired, and I'm going to check it 3 times against the doctor's orders. I have provided proper hand hygiene, and I'm going to glove down for this procedure. All right. I'm going to pour my solution into the basin here. And with a cotton swab, I'm going to dab in there, and in my trash receptacle, drain the water out. I'm going to clean out the exterior portion of his ear here. Throw that into the trash receptacle. And then Kevin, I'll have you hold the basin up around your ear here and forward and to the side. And then I'm going to take my syringe, and I'm going to take 30 to 50 milliliters of solution, and I'm going to pull that into the syringe here. And I'm going to irrigate with the ear back, and I'm going to irrigate towards the roof of the ear because I don't want the water shooting directly onto the tympanic membrane. Bring that down just a little bit, Kevin. And in it goes, and I allow for time for the fluid to flush out. I don't want it to be too uncomfortable. Now I'm allowing for drainage. And as the ear is draining, I'm looking at the color of the fluid that's coming out, noting its consistency, and I think we'll do it again. Since again, I'll take in more solution, and at the roof of the ear, irrigate some more. All right, I'm going to give ample time for the solution to come out. I'm going to take another peek with my otoscope here. You can just keep your head tilted still. And it looks clear. I'm going to have Mr. Tebow lay his head down onto the towel here that I provided, and we'll just lay straight down onto the table. And then after a few minutes of him laying on the table, I would raise him up and provide him some cotton balls just to stick in the outer portion of his ear. I don't want to put anything into the ear canal, but this is just going to provide just set right out on the exterior part. It will just provide collection of any extra drippage that would be going on after he leaves the clinic. You may feel some discomfort the rest of the day, but it should go away, and it should be pretty mild.
Okay.
All right, and you can sit back up. I'll put this in the exterior portion of your ear. Always remember never to put any cotton Q-tips or anything into your ear canal, because that will push any earwax that you have further into your ear canal. All right?
Okay.
Do you have any questions for me?
No.
All right, then I'll inform your provider that everything went well, and I will inform your provider that everything went well, and that you didn't have any questions. And if anything goes wrong, don't hesitate to come back.
Okay.
All right?
Yep.
It was good to see you.
Thank you.
Yep, have a good day.